Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Carbamazepine, important information for you. Hi everyone. Today we're going to talk about carbamazepine, a very important medication for people living with epilepsy. If you or someone close to you has epilepsy, this video is for you. So, what is carbamazepine? It's an anti-epileptic drug, which means it helps control seizures. It's not only used for epilepsy, it can also help people with bipolar disorder or nerve. It's especially helpful in treating partial and generalized seizures. If your doctor has talked to you about carbamazepine, pay attention to learn more. So how does it work? Carbamazepine stabilizes the electrical activity in the brain, like putting a brake on the nerve signals that fire uncontrollably during seizures. Regarding the dose, it's super important to follow your doctor's instructions. Normally, you start with a low dose and gradually increase it until you reach the dose that keeps you stable. For it to work properly, you have to take it regularly. Let's talk about side effects. Some people may feel dizzy, sleepy, or even have blurry vision. If you notice anything unusual, tell your doctor. Also, while taking carbamazepine, avoid alcohol and be careful when driving. Remember that carbamazepine is not for everyone. If you have liver problems or any allergies, you have to be extra careful. Before changing any medication, always consult with your doctor. To finish, let's go over the key points. Carbamazepine is an essential medication for many people with epilepsy and other conditions. Take it correctly, pay attention to the side effects, and you'll be on the road to successful treatment. Thank you so much for watching this video. If you have any questions, leave them in the comments. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.